Sorry about that. I don't.
Whatever, okay.
Yeah, just,
Yeah,
but I need them back. the
Yeah,
tab.
I'll get them back.
Okay, thank you.
But
Thank you very much.
yeah, she gave one to her.
Wade's here,
She has a.
Law Foundation's here.
Yeah. She has a. Oh, I don't know if I can do it there.
Here.
Definitely
On some,
It's just.
I know, yeah.
I gotta be mindful, but.
So everyone help yourself to all the treats and that Donna has, I think Salem have kindly brought in. Get going in just a couple of seconds here.
So who are you?
Tina from my water bottle.
Say the name again.
Tina, yes, I'm a community health worker.
Nice to meet you.
You didn't tell that.
PHAYNA.
That's a weird name.
She's lying. I am
Yeah,
not
it's
harmless.
her name.
Goodbye, me or Janet? I'm sitting right beside Janet.
Good morning, everybody.
Hi, Mike. And once everyone gets settled in seats, we will get going.
Janet, just so you know, I'm only going to be on for the first half an hour or so, then I need to go to another meeting. My apologies.
Thank you very much, though, for letting us know. Glad you could join us for a little bit.
You bet.
So Janet, this is Deb.
Hey, Deb.
Hi, I'm gonna have my camera off only because I'm on a medical leave and I'm just not really up to probably being on this call for probably more than an hour, but I just wanted to let you know.
Thank you very much. That's great. Hope everything goes well.
Thank you.
Oh, good snacks today.
Oh my God, and Curly's here today too.
Wind blowing luck.
Oh, hard. Grab something, get settled.
Yeah.
There's actually really.
I thought, that's what I thought.
Yeah, I know, I-
Saw it, I'm like,
Yeah, I brought it on before, but that's all right.
yeah, okay, thank you. You and I need to touch base.
Yes.
Yeah, okay.
So see what that looks.
This is a festive group today. What did you all do with your Wheaties before you came?
So we're
Sitting there like I do.
Spring is almost here.
We're not right on it, right?
Yeah, because people right here have no brains.
Right.
You know, like the joke.
I know.
I don't want to forget.
The good ones. Yes.
It really is. I don't know why.
Hey, Amy. How
Hello,
are you?
good.
For those of you that are online, just kind of waiting, where everyone's getting set here, we've had a couple people just came in. What's that?
Oh.
The chat?
The AI.
Yeah, thank you.
That person wants to play with your eyes, that's all.
I've noticed. All right, good morning, everyone. Rocky, we'll just let you do your thing. My name is Janet Langdell. I'll call the meeting to order at 10:03. I work with Sylvia Valley Transportation Collaborative. I have the great good fortune to be facilitating this meeting as chair of the RCC7. We'll start by going around and doing some introductions. Why don't we start on Zoom? And I see Terry Palmer there. I think you're on mute.
Morning,
Terry.
everyone. Sorry, lost my mouse there for a second. Good morning, everyone. I'm Terry Palmer. I'm now the Executive Director for Advanced Transit. And when I have time, I like to join the other amazing RCC meetings, especially this one, to try and just take some notes and bring it back to Region 1, which I am still affiliated with. So thank you very much. Nice to see everyone.
Nice to see you. Mike, we know you're there and you're driving, so we're not gonna bother you too much. Mike Appleberg from United Way. Matt, I'm gonna ask you, I can't see all the names, so if you can call them out.
Well, I'm Janet. Janet, Mike Affelberg, President of United Way, currently experiencing transportation.
There you go. Bravo.
Lived experience.
And I'll go around, I'll read them off and you guys can all respond. I see Jay Leach.
Hi, Jim Leach with, I'm new at this, so this is my first meeting, but I'm with Harbor Care. And I think 2 squares over from me, you'll see Caitlin Tucson. I'm the new Caitlin Tucson. So I'm the Veterans Employment Specialist, and I also do outreach and whatever else they ask me to do. So thanks for having me at this meeting. I look forward to learning some things.
Thank you.
Welcome.
Caitlin.
I work at Harbor Care and now I'm doing housing case management for the supportive services for veterans and families program. And I don't know, I think it's just good to be in these types of meetings to know what's going on with transportation for my clients.
Thanks, Caitlin. All right, I see Jessica Blanchette.
Hi, everyone. I'm Jessica. I'm the housing coordinator for Bridges.
Thank you, Jessica. Mary Frances.
Hi, I'm Mary Frances Shonley. I'm the program manager with the Aging and Disability Resource Center. I try to get at least myself and my staff here. Usually my staff is at present, Dawn, but she's out today. So I wasn't involved in any other meetings, so I figured I would get onto this one.
Thank you. Victoria.
Hi, I'm Victoria Lee. I'm with Granite State Independent Living. I'm actually Deb's executive assistant who will be introducing herself in just a moment.
Hey, Ben.
Hey, Matt. Deborah's the CEO of Granite State Independent Living, and Victoria is also my alternate. So if I'm ever not here, Victoria would be my alternate. Thanks.
Thanks, Deb. I see Ben.
Hey, Ben Herbert, Region 8 Mobility Manager.
Great. And Nani.
Hi, good morning, everyone. Nani, one of the Main Street United Methodist Church and the Nashua Area Interfaith Council, plus other community groups. Thank you.
Nani. So I do see a couple note takers. There's Fireflies and Williams. I guess they're not going to introduce themselves.
Who's Williams' notebook?
I think that's a note taker for William.
Okay.
Yeah. So I guess we're good.
So why don't we start around the table? Mr. Leach, welcome.
I'm Charles
Lewis.
Lewis. I'm a recently appointed voting member of the SCC, representing Commissioner Davis of the Department of Education.
I'm the Director of Volunteer and Community Engagement at United Way of Greater Nashua.
I'm Marina Vaz. I'm environmental justice advocate with Conservation Law Foundation.
I'm Bill Ayer. I'm with Voices of Major Drive.
I'm Marianne Gamache. I'm a housing specialist with Greater Nashua Mental Health.
Carrie Miller. I'm the mobility manager with the Nashua Transit.
My name is Amy Hunt. I'm a disabled vet consultant.
Hi, good morning. I'm Angelique Pandolf, Director of Transportation at Easter Seals and recently appointed SCC member as well.
Good morning, I'm Rocky Morelli. I'm the Executive Director of Opportunity Networks.
James Wilkie with Caregivers.
Hi, I'm Tina Michelino. I'm a community health worker at Lamprey Healthcare. This is my first time attending the meeting, so I look forward to getting to know everyone and what everyone has to offer here. Thank you for having me.
Hi, I'm Johnny Arquezo, President of Meals on Wheels, Hillsborough County.
John Ferretti, this cheese is hot.
Donna got it.
From Gate City Bike Co-op.
I didn't make it. I didn't make it. I'm Donna Matso. I'm the Regional Mobility Manager for the RCC7 here at NRPC.
Hi, I'm Salem Quinn. I'm the Administrative Communications Coordinator here at NRPC.
Hey, Matt Wade, I'm transportation staff here at NRPC. And we need help with the RCC. Our members.
Welcome to you all. Just as a matter of housekeeping, when it comes time to vote on a couple of things that we have that are action items, voting members will be polled kind of by organization. Every organization that is a member has one vote. So if we kind of skip over you, it's probably because you're not a member yet, but we want you to be members. And just because somebody may not be an official member, we do encourage everyone to participate in the discussions and the sharing of ideas and information. So that said, first item on the agenda is the approval of the February minutes. That was attachment 1. Does anyone have any corrections, concerns, changes for the minutes? And I see page in our packets that are printed, page 1, not necessarily page 2. But you did get these online in your packets. Anyone with anything?
I'll make a motion to approve.
Thank you for the motion. Is there a second to that motion? Carrie Miller makes a second. Since we have, let's see. We have voting member United in the room. Now GSIL is online, so we have to do this by roll call. Oh boy, here we go. GSIL, either.
Yes.
Yes. Is there any other voting member besides me? Mike's not there.
Jessica from Bridges.
Yeah, Bridges. Oh, thumbs up. Got it. Great. Okay. United Way.
I'll defer to Sarah.
Okay,
Yes.
great. The Conservation Law Foundation.
State I wasn't here.
Abstained. Great. Major Drive.
Major Drive.
Nashua Transit.
Yes.
Amy.
Yes.
Janet, yes for SVTC.
Yes.
Future Seals. Opportunity Networks.
Trying to remember if I was at the meeting. I don't see my name on it, but
We weren't here.
then I abstained for not being present.
There you go. James for Caregivers.
Yes.
John.
Yes.
Bike Co-op. Did I hear an abstain or?
Yeah.
Okay. And then NRPC.
Yes.
All right, Salem, you got all that?
Who made the motion? Thank you.
Yep.
I got it.
Excellent. That was a majority.
Yes.
Passes. Super. All right. We asked Angelique as the champion for the SCC strategic goal number 1 about communication to kind of share with us any updates she has from the SCC. And although the agenda only mentions 2 things, what we're going to ask her for is anything about the strategic plan, especially number 1, goal number 1. Anything that maybe updates about the statewide community transportation assessment program that's been going on, that's been headed by the area Commission on Aging. They had a big meeting last Friday on that, so maybe there's some good information. And then the third thing was anything that might be coming out of Concord regarding the rural health transformation grant that DHHS got from the feds. That's that multi-million-dollar project. So, Angelique.
Yes, so you may have noticed that in the packet, there contains a draft template that we have sent out to all RCCs, and we're looking for feedback on this rough draft executive summary, so to speak. The idea is that this would be sort of a consolidated and distilled version of RCC meeting minutes, so that way it's a really easily digestible way to communicate with the RCCs and the SCC. So, you know, one of the main things is capturing, obviously, you know, successes that are happening in this region. And then also, you know, carving out a space in this template for the RCC to include, you know, inquiries to the SCC. What's, you know, statements that this RCC wants the SCC to understand or know, questions, things of that nature. So it's really supposed to, you know, leverage the work that's already being done by the RCCs and not create more work, but just taking information from the meeting minutes that are being created already and distilling it down. So it was created, the process to create this draft involved going through and reading through all of the different regional RCC meeting minutes. And it really kind of, you know, highlighted 4 groups of topics that are most commonly brought up during RCC meetings. And that's where we're getting the governance, the finance, the mobility management, and the operations as kind of those main themes that we see. So today we're asking for folks to, you know, provide any feedback on this template. And again, the goal is that we're increasing and strengthening the communication and the relationship with the RCCs and the SCCs.
Just a couple of points to clarify, just because I want to make sure I'm on the right path. This wouldn't have to be done for every set of minutes if we met every month or every other month. It's basically going to be a periodic summary of those minutes.
Right, and we haven't, you know, determined what that, you know, period of time will be, but, you know, we, in the work group, we've talked about quarterly, maybe semi-annually. So that's still up in the air, and the reason why too is because RCCs meet at, you know, on various different cadences. So some of them meet only quarterly, some of them are monthly, bi-monthly, you name it. So that's still being ironed out, but again, this is really just to try to capture.
And this is just one strategy.
Correct.
The
Yep,
work group is
it's really
coming
a
up.
starting point, and you know, again, looking to just really get the
Carrie.
And then kind of stemming off of Janet's question, we talked about this the other day, but I just wanted to ask you since you're here. So this is like not in place of like the regular meeting minutes, right? Like
correct.
That was kind of our understanding, but I just want to clarify that with you. So like, and it makes sense that you just said this would be like a periodic summary that you know you guys would get. So okay, fine.
Yeah, kind of like a condensed snapshot, if you will, of meeting minutes. Yep. So does anybody have any other questions about the template or feedback?
Question. So, as part of my role as EJ advocate, we host a meeting, a monthly meeting that actually just happened last night, on transportation equity. And that the reason for that, a lot of folks like can't make this meeting because it's during their working hours, so we meet in the evenings. But we get a lot of input from like grassroots members of the community that rely on the bus, on walking. And I'm just curious, like, I would love to explore any synergies between what's happening at that meeting and how I can share that input here where it's appropriate. And I don't see a reason why we shouldn't, you know, relay that feedback, bless you, to the state. But so I guess my question is that, like, how, like, where would the appropriate place be to plug that in?
So you're really asking 2 questions. One, you'd like to share it with this group to make sure that the synergies locally is there. And 2, for things that are extremely important or are state level, we want to make sure that that information moves forward. I think it's very appropriate for you could provide a written statement of the concerns and share it with the group. If you send it to us, we'll get it sent out. You can bring anything that you learn, obviously anything that any of us learns or hears, we're bringing to the meeting to share. So that's appropriate. And then we can work through, you know, again, incorporating the feedback that you're getting into this quarterly, whatever report to make sure as, you know, additional information. This is what we're hearing from this other group that we're working with.
Yeah, and it may go under like a variety of different spots in this, right? Like, I guess it really depends on the information that you're sharing, but like, if you're having successes in your group like that, you know, we wanna obviously, like Janet said, broadcast that to the RCC and then it should, you know, flow down into the next.
But we need to hear it here. You know, that's the important thing too, is that regionally, not all of us can make an evening meeting because we have other conflicting meetings. Thank you very much. But again, to continue the conversation, I know you have the meetings here in this building. I don't know if somebody from NRPC generally goes. So, I mean, and NRPC is a member of our organization as well, as are you. So there should be a way to share that very easily.
Okay.
Absolutely. Anyone else?
Can I make a comment?
Yeah.
Just a general comment. First off, Angelique, congratulations on your appointment. I think that's fantastic for not only us here, but the state level. Charles, thank you for attending. I think this initiative is really important. I'm coming up on about 2 years representing as a service provider in the area. I have a long tenure in the Nashua area. In my 2 years there, I find many items very confusing and I'm still trying to wrap my head around a number of them. So I think this initiative that you have here will help clarify things, not only for us in the work that we're charged with locally, but what the priorities are on a statewide level. And I think that's really important. Oftentimes we run into issues that I know myself personally I find confusing. And Terry's been great about representing the state initiatives, but she's been kind of the lone soldier, and I think it's a lot of burden on one. So I think it's better to see that collaboration and cooperation because we've identified similar issues that are going on the statewide level, and it makes sense. And as I become more familiar and see what the other regions are doing, there's a lot to learn by sharing information and working together. So I think something like this has great value, and I'm happy to see you guys pursuing it.
Well, the sharing across regions would only presuppose that these documents are available for other regions to read. One of the things.
But to flow downward
One
as
of the
well.
things that
on
we've
their
talked
initiatives.
about, and has been mentioned at the SCC level as well, not that I'm on the SCC, it's just that I know that this was shared, is maybe to do some kind of quarterly newsletter that talks about all of the regions together. And certainly, I agree with you, Terry's been really good. When she was in the role as the statewide mobility manager, she's since moved up and over. I don't know, but up and over, as the executive director over at Advanced up north. So, but we are very fortunate to have both Deb from GSIL and Angelique who regularly come to our meetings from the SCC. And now Mr. Lewis. I want to call you Leach. I'm sorry. I don't know why.
It's Charles.
Thank you, Charles.
Mr. Lewis is my father.
There you go. And Charles is, who's joining us today, and I'm sure will join us in the future as well. So.
Yeah, and I think, thank you for your comments. I think one of the things that I should mention too is this is a two-way street, right? So the idea is as well that the SCC, like again, similar fashion, however, this takes shape, but the SCC will also have a consolidated, version of their minutes so that this communication is easy, and streamlined from both ways. And whether that newsletter, helps that flow along
Or they're doing their own copy of that form and distributing it to the.
or both.
Yeah.
So, but that's still in the works as the work group continues to move forward.
We have some chat
Jessica?
questions there.
Yeah, Jessica has her hand up.
Hi, so I'm curious. Well, first, I want to definitely echo what Rocky was saying. I think that something like this would be super helpful, not just for collaboration, but for people that are just getting into this group and things like that, just for understanding of what's going on and what people have been working on. But do you think that these will live on a platform or something like that for accessibility?
Yep. Yeah. So the idea is, I'm not sure if everyone's familiar with the Keep New Hampshire Moving website, but we are hoping that that will be the platform where all of these documents are gonna live. Where exactly in the details surrounding that hasn't fully been ironed out, but that is the direction, because, right, it is important that, especially, right, new members who come into an RCC, they have, you know, this information is accessible and available to them so they can really, you know, get up to speed. And then again, for other regions too, right? Like, it's not just about one RCC, but what are the other regions doing? They can read these documents and learn about what's happening all over the state as well.
We had some discussions and show and tells about Keep New Hampshire Moving when it first rolled out. And it continues to evolve. That is the SCC's base of online documentation. And if you look at the back of this flyer, there's a lot of information about Keep New Hampshire Moving. We continually encourage people to go there, both for the fact that it is a statewide transportation directory. It's not, doesn't include all the for-profits and everything else, but it is a growing statewide directory of transportation options. It also has information about all of the regions and the SEC. It is the place where regional minutes and SEC minutes are housed, as well as other documents and membership information, et cetera, et cetera. It's worth grabbing a cup of coffee, grabbing a tea, grabbing a chai, sitting down and just kind of scrolling through the various sections. You'll also find a copy of the up-to-date strategic plan from the SEC on their resources page, as well as a number of other documents. And it's a good resource, and it's a growing resource. Anyone else? Questions on that? Is there any movement, Angelique or Charles, on any of the other strategic goals?
So I don't have any real like updates to provide on the other strategic goals. I know that the groups are really kind of in their infancy and just getting together. I want to say that I think goal one, you know, we were eager to get this moving, so that's why you know, we're getting this as a starting point going. But as far as I know, the other work groups are just getting together now, and we should see some updates from them hopefully soon at the upcoming SCC meetings.
Harry's got her.
Harry.
Thank you. I do know that goal number 2, Able New Hampshire, has been working on that kind of behind the scenes for months now. And I know that Steve Workman, who is the state coordinating council member for that group, did participate in a meeting. Well, it wasn't really a meeting. It was just a discussion on how they were going to move forward. But I don't know if the goal number 2 group actually met. But there is some work already being done on goal number 2. I think it was goal number 2. Is that the one with lived experience, having someone in each RCC? Okay, yeah. So that one is, there's been some movement on that one over the past few months.
Well, there has been here too. Thank you, Amy.
And I've been trying to hit many different RCC meetings, and most have a good start on this issue with the lived experience. Members, voting members with lived experience.
Great, great.
So
needs assessment.
Yeah, if nobody else has any feedback on this, or you can always send an email to reach out with feedback or something else. So for the community transportation needs assessment, so they just conducted a workshop last week, and it was because they're really trying to I mean, they're getting to the end stages of that project that's been happening for I believe it's almost you know, the past year or so that this has been going on, and the idea is to really get you know, a baseline for what's going on in New Hampshire. Part of that project entails, and this was just sent out and is still being sent out sort of in batches, is my understanding, a transportation provider survey. So some of you you may have received this email already. This is being sent out by Steve Workman, who's been working closely with Jen Buteau from Impact Consulting, who's been like leading the charge on this project. It's housed under the Commission on Aging. And so this is kind of one of the big initiatives that's happening right now, is trying to have providers fill out this transportation provider survey. And so basically it asks you questions about you know, what type of service that you provide, and depending on, you know, whether you're a big provider, whether you're a smaller provider, I know that they have been sort of trying to leverage like mobility managers for especially the smaller ones who may have some difficulty understanding sort of the industry jargon with that. But it is really important that everybody tries to fill that out. If
They only want one person from each provider to fill it out.
Yeah, each provider, right, should fill it out once.
And there is a I think it's 7 or 9 page instruction manual to go with the survey. I haven't quite finished reading the entire instruction manual yet before I jump into the survey, but we'll get there.
Yeah, so I did the survey myself, so I know it's really not too cumbersome. It's just asking, you know, about your level of service, what type of funding you receive, if you have any, you know, things like that. So I just wanted to put a plug out for that if you see that coming, please complete that. Yes.
I'm sorry, quick. I didn't know, do you know or do you know if National Transit's gonna get that? If not, I wasn't sure. I haven't received it. I don't know.
I will look on my email to see if I can see the CCs. I was wondering, I believe Camille probably got
That
it.
makes sense, because I was just thinking if I was supposed to get it, I haven't, so I'm
No,
going to her
no,
that.
it
that's
wasn't one of
fine.
those chair, vice chair things. It was actually to providers. So I'm assuming James got one. Check your email.
Camille, I know,
I-
gets a lot of emails, so I might have to.
I'll double
in
check to
there.
make sure. Yeah, and again, I think it was kind of a broad stroke. I don't think it was just 5310 recipients.
Yeah,
Right.
that's fine, yeah.
Right, yeah, I guess they were trying to break it up into sort of 2 tiers of providers, like ones that receive, you know, funding through RCC, federal funding, state funding, whatever. And then, you know, smaller ones like VDPs who may not be receiving funding, you know, smaller.
And then probably the known public transportation providers like Coast, MTA.
Yeah, I think that would.
Are
Right.
kind of on a different level.
Yeah, so.
Let's be on the lookout for it.
It would have been sent from
Steve Workman sent it.
Steve at Transport New Hampshire. So, but yes, so if you see that, please fill it out. If you need help filling it out,
Call Steve.
call your mobility manager, call Steve, call me, call
Steve.
any of those people.
Do you have a date for when this is going to be published, ready, unveiled? That's the word I want.
No, there was no specific date. I think that's being ironed out possibly still with the Commission on Aging during the workshop that was, you know, talk about when our like reports gonna be happening, and different things like that. But the goal of the workshop that took place was to really just showcase with, you know, stakeholders, what are some like preliminary data findings? Do they make sense? Do they, you know, what resonates with you? What's going to be the most useful, right, deliverables basically coming out of this project?
I think Ben has his hand up, does he?
Yeah.
Yeah, I heard that April 20th was the anticipated day for the release, but I don't know that's how set in stone that is, but that's what I heard.
Thanks, Ben.
Yeah, thank you. And then as far as the rural health transformation grant, there's not really a whole lot of updates. I know that the state was assigning, I guess, creating sort of like domains for each of the project areas, and those are currently being assigned sort of executive directors. So I think it's still very much in the infancy stage, and at this point, like, the SCC doesn't have a whole lot of other information about how that's coming along.
Or how we're gonna be able to dovetail with the initiatives that are across a number of contracts. If at all. Terry's got her hand up.
Thank you. So if you go to the Go North website, there is now 6 contracts that you'll be able to see. And with my work with some of the North Country hospital folks, there's only 1 contract that even mentions transportation. So we've got a lot of work to do. What we're hearing, and of course this is all hearsay, we're not sure, is that I was in a webinar, I think a couple of days ago, and there is going to be very strict parameters around this funding. That's what we're hearing across the country. So it's not, and I think that's where, like the state of New Hampshire is kind of looking at, okay, well, these contracts are very vague, and CMS at the federal level is not going to allow vague contracts. And even on the Vermont side, folks are still kind of like not really sure what the parameters are going to be around the funding. So I think what's going to happen, and I have heard that there's going to be a request for proposal procedure. That's happening in Vermont as well, where, you know, agencies might be able to apply for funding. We're not sure if that's going to work in New Hampshire. But that's kind of what I'm hearing on the Vermont side. So fingers crossed that we're going to be able to do that on this side as well. And if we have, and it's got to be an innovative project. The other thing I'm hearing a lot of is, instead of, and this blows my mind, and this is happening countrywide, instead of fixing the transportation barriers, they're bringing the medical field out into the rural areas, like rural EMTs and those type of programs. Telehealth is a huge one. Another big focus out of all of this funding is retaining workforce. So that might be an area where transportation might be able to come in. So that's just kind of what I'm hearing throughout the country, because I still kind of am paying attention to that. And you know, I have one of the biggest employers in my backyard with DHMC. So, you know, I'm really hoping to be able to partnership with them and try and break down the barriers of the transportation from the North Country down to Lebanon. So I will try to keep you guys updated if I hear anything else.
Thanks, Terry. And thanks for mentioning about the contracts. I know when I looked at the contracts as they were listed at the Governor and Council's page, and I did a search in each one of them on transportation. 3 of them were only mentioning transportation as part of a definition section. And as you pointed out, only one of them talked about transportation within the body of the contract. But it was kind of like there with not a lot of meat around it. Certainly if employment transportation, you know, I know we always talk about non-emergency medical transportation to get people to healthcare services. But the other big one that's, you know, the elephant probably in the middle of the room here is employment transportation. And certainly that's a great need statewide as well. So stay tuned. And if anyone hears anything through your sources, I mean, I know you all have different connections, please share it. Let us know, because, you know, if there's an opportunity to be had in this region, I think we as a group want to be supportive to whoever can avail themselves of that opportunity through this grant. Rob.
It is helpful to know what those priority areas are. You referenced a couple, if there's a formal list so that we can start thinking about how we might be able to approach some of those categories.
Take a look at the Go North website, and we can also I'll send that link out. We'll make sure that link gets sent out after the meeting.
And I have one other issue I'd just like to touch upon. Services to people with disabilities is often categorized as long-term health care, not acute care. Is there any talk in any of this discussion that's happening that proposing issues to solve access to long-term health care for more significantly disabled individuals, other than the current Medicaid funded structures? Does that exist anywhere in any of these discussions that you're aware of?
The only thing that I've heard is actually in the webinar that I was in the other day, and if I can find it, it was, I think I deleted their survey already, but if I can find it, I'll send it to you. It was Hartford something or other, but it was basically the Rural Health Transformation Plan and how is it going to affect older adults. And basically what they're trying to do is keep the person at home, which is what we all want to do, right? Is, have our older siblings or relatives or whatever stay at home, and folks with disabilities, because obviously there's a housing issue throughout the country as well. So they were really focusing on how do we keep folks in their residence? Is it coming in and making accessible restaurant or bathrooms, or is it putting a ramp on their home? Is it home health care? So there's a lot of conversation about that. But I mean, again, the elephant in the room, we all work in different spaces. We all know the workforce isn't there. So I'm not sure how it's going to happen in New Hampshire. We're all, struggling to find medical folks. I think they tried the paramedics in the field a couple of years ago, like right after COVID, and there wasn't sustainable funding. So I know that's a struggle in our state right now, is finding enough EMTs and ambulance services, that type of thing. So it'll be interesting to see how we handle it. I hope that the funding does flow into the ambulance services, because that would be a huge relief in our state. But yeah, I'll try and find that webinar for you guys, and I'll send it out to you. I'll send it to Janet.
Yeah, if you send it to me, then I can send it out to everyone, or make sure it gets sent out to everyone. So,
Yeah.
And I'll add the other two websites as well, Go North and Keep New Hampshire Moving. Terry, yeah, what you just mentioned though, the first part, that's very consistent with trying to keep people at home, is very consistent with the Choices program, Choices for Independent Living, which is again separate from what Rocky's talking
That's what
about.
I would choose, but
yeah.
advocating for the broad base of all.
But unfortunately, having
residents.
worked in a similar, having worked in the parallel program in Connecticut, there's not, it's not an overabundance of funding available per person, though there are some nice nuances. And that was actually something that was brought up at one of the Able New Hampshire transportation seminar meetings, that if I can find it, I will send you that link, because all of those Able New Hampshire past Zoom meetings are all available on their website as well for reference. Yeah.
So I wanted to ask Terry a question. So when this originally came out, we did a survey and we put in for 25,000 for wheelchair transportation. And do you know if that will be funded? Is there any way you can go back and ask somebody if that's going to be funded? Because it was part of what we wanted, and you would ask us for our input on it.
Right, and I put I put something into the portal too for statewide medical transportation. Basically, if the transit agencies could work with their local hospitals and work together for funding. And I never even received an email as far as like, thank you for your submission or anything. So there is still the possibility that DHHS is, DHHS is still meeting with DOT. We haven't received any feedback from Fred either. So hopefully we'll have an update at next week's meeting. But yeah, I'm not sure if they're going to transfer funds from one department to another department. Who knows?
Thanks, Terry.
I'm right there with you, Donna.
Thank you.
That's all I have.
Charles, did you want to add anything from your perspective as an SCC member?
I think it's been pretty covered. As I said, I'm recently appointed and I'm still trying to absorb everything that's going on.
Yes, absolutely.
And my position with Department of Education, vocational rehabilitation, I'm not immersed in the transportation issue as most of you already are. So it's an even tougher stretch for me to suck some of this up and absorb it.
And I will tell you that that is still an area where we do get calls. Folks that are in your program that need transportation either to work or to classes or whatever.
Yes.
So there is a link. There is a
Well,
link.
there's definitely a link.
Yeah.
But not one that I've been immersed in.
Salem.
And that's one of the reasons why I'm trying to hit all of the different regions to absorb as much as I can.
That's great. That's great. And thank you for coming. It's not.
Just
Salem.
wanted to note, Fred Butler from DOT was able to join remotely after we already did our introduction. So if you have anything to add?
No,
Fred,
I'd like to actually go to Deb and just give her the opportunity as an SCC member if she'd like to toss in anything, if you're feeling up to it. If not, that's cool.
Thank you, Janet. So I think Angelique did a good job in Terry. We did have our leadership meeting yesterday. We didn't receive any more information on the Rural Health Transformation Grant than what was presented today. So, we don't, we know those 5 or 6 contracts were at the Executive Council last week. So, but nothing has come down to the SCC level. And I know Fred Butler's here. I think he indicated yesterday that he hadn't received any more information either from a DOT perspective, but certainly let him answer. But I think Angelique did a nice job of covering what we do know and what is available information out there.
Okay, so all I'm seeing on Fred, I actually see this. It's a thumbs up. Fred, you want to verbally add anything?
Sure, yeah. I'll just say we share in the frustration of the lack of answers, but no, there's still nothing yet. There was a GNC meeting yesterday that, some of you probably saw that, but transportation, I think during the meeting, they did just give a sort of one-liner saying transportation contract will be handled separately from what's going through GNC now. So Shelley did confirm she's still trying to work to get together with HHS, and it just hasn't happened yet.
Thank you very much. Anyone else have anything on this topic? All right, let's roll forward.
I'll just comment, I think it's great to have all these SCC members here.
Oh, it is.
Providing feedback to us and working with our group. So this initiative seems to have value already from where I sit.
Well, I will say that having the SCC actually formulate a very specific strategic plan with goals and work groups attached to it is again part of the evolution, and it brings forward more things that we can wrap our arms around and have discussions around, and move all the work statewide forward. So it's a good thing. And this is not something that they've had in the past. Matt, if I remember correctly, back, nothing really.
No,
I mean, the last big meeting we had about a strategic plan was when we were in some room with brick around it, and not Patrick, but the guy that was there before Patrick led it. And that had to have been 2012. 10?
Sounds right.
Yeah. There you go. Let's roll forward. Donna, you're up, Regional Mobility Manager. Got some highlights and outcomes.
I do. Thank you. So I received an email from Steve Workman, and he recognized the RCC7 as an example of effective regional coordination. So that really speaks to everybody here that we try to coordinate with each other. So that's nice. I'll just pass that along if you want to see it. So Also, I'll just give a little update on the youth transportation update. So we're trying to working on getting the drivers part of the youth transportation, and we've met again. It was off the table because nobody wanted to take on the liability for the project. But now it seems like there's going to be funding from the New Hampshire charitable funding to fund a driver mentors program. So that's good news because that's been the big problem with youth driving is having a volunteer for the 40+ hours needed to obtain the license.
Donna, who's on locally championing this to accept that funding?
Well, so it's the Big Brothers and Big Sisters organizations. So they're willing to take the liability with this. So that's who's driving this right now at this point. So, but we did meet. So that's a good thing. And I had a call this week about this. So the initiative, it seems to be back in play, which is a good thing because the driving is really important for a lot of people. And basically it's a work thing. The call today was for somebody to get to, it wasn't today, it was this week was for somebody to get to work, a young person from community college system.
So what is the initiative? Someone is going to train kids that don't have driver's license. What is the initiative?
So it's a youth transportation initiative, and it had been brought up previously at our meetings, but then it had been put aside because we met and nobody wanted to do the liability for.
If I'm not mistaken, there's a cadre of youth out there, whether they're homeless or whatever, who want to get their license. But in order to get your license, you either have to go to class and take those 40 hours of driving, or have someone to drive with you to do that. That's the piece that was missing. And this grant is going to help fill that void.
Right, exactly. And it's really to get volunteers to do this because you really need volunteers to do this. It isn't that you're going to pay somebody to do these 40 hours. Mm-hmm. So it seems like it's back in play. I'm just letting you know that it seems like it may happen. And I did go to one meeting on it, and there has been a call about it.
So is the funding being used to do mileage reimbursement for the volunteers, or is it in part being used to pay for kids to use the driver schools that are around here?
So it's going to go through the Big Brothers and Sisters, and then they'll determine it isn't fleshed out yet at all.
Okay.
So, but I'm just letting you know that it's back on the table, the initiative. So, yeah.
And they received the grant though?
It still isn't so concrete yet. But
so the grant hasn't been awarded yet?
I don't think so, Janet.
Okay.
I'll let you know though. I'll let you know. So
yeah, trust.
Also, the Exuda program has ended. That was a $600 no interest loan for needy people. So I know some people from Greater Nashua Mental Health, Mary Ann, have asked me about that various times. But DCU, it was bought out by another entity. Right. And they thanked me profusely for my help with this, but they're not doing the program anymore. Which it did help people kind of get going. And the initial reason for this was the $600 repair. A lot of people come for repairs, or they maybe to purchase a car, and that's why we wanted to partner with them about it. But it's over. So if you do have those flyers in your organization, just please take them down. Right. So thank you. So as far as wheelchair rides, so I had one wheelchair ride, and I mentioned to the wife to call to the town to let them know that there's a wheelchair residence in the house, just so that they know, call the fire department, so just so that they're aware of somebody in a wheelchair in a house, so they could get there if there is a fire and maybe try to help the person a little more.
What town was this?
Leidenborough.
I almost kind of think that they know. Leidenborough.
Right, but I want to make sure that the town, the fire department knows that if something does happen with that house, they'll be able to try to help the person out. So I can do that.
Leidenborough is crazy.
Grew up there.
So I've had some calls from that, and that's one of the initial things, that we wanted to get that wheelchair transportation because there was nothing there. So, since the last meeting, February 26th, there have been 32 calls. And we've also reached the 1,000 call mark since the beginning of the program in July of 2022. So as far as unfulfilled calls, one call could not be filled was on Medicaid. And so I was hoping maybe Marina, if somebody could help with that Medicaid transportation piece, because it is that I get sufficient calls about Medicaid and people don't want to use it, but that's really what's available. So I was hoping that maybe we get some support here to kind of work on that problem a little bit.
Do they say why they don't want to use Medicaid?
Well, yeah, they've said a few things. They say the drivers are smoking pot, they're late, they get late to the appointment, a multitude of reasons.
Donna, so just quickly, because you brought that up, I know Able New Hampshire was looking at having sort of a listening session. They're working on setting it up with the folks from CTS and MTM just to be able to tell stories. So when that comes out, I hope you'll be able to attend and share some of these stories that you're hearing.
Right, thank you, Angelique, and I do try to go to those because I do feel like they're very pertinent.
Yeah, thank you.
It seems historically, going back over the years, that the Medicaid broker system has always been problematic. And that's me, I'm just saying that's my take.
No, that's, and I would totally agree with that, and I think most everyone at the table has heard the same thing. I mean, they're either, I don't know about the smoking pot part of it, but you know, consistently we hear that they either don't show up, they're late, or there's a whole bunch of people in, you know, for the ride. So it's a big shared ride and it's taking forever and ever and ever and ever to get home. Even more so than our shared rides coming from Nashua because they're having to cover a wider area. At least I've heard that a couple of times.
Yeah, and you know, Donna is hearing this and you know, and is just trying to keep kind of bringing it up just so that maybe it becomes an issue, right?
Hey guys.
So that's.
Have a sidebar later on, okay? And I would suggest too that the other piece of this, oh my God, they just took me off my brain track. When and you two.
It's my fault.
I can't remember what I was gonna say, but it was something about Medicaid transportation.
Yeah, just that we're trying to keep raising it up because it sounds like it's sort of institutionalized long-term issue
And what I wanted to point out for those of you who are new is with the funding that we get through the RCC FTA 5310 funding and the New Hampshire DOT funding, one of the things that DOT stresses is that if alternative funding sources are available, especially Medicaid, that those funds should be used for transportation, any MTU transportation first, and not our funding. And again, I understand that it's sharing the pots. If it's available, it should be used. That's why the Greater Nashua Community Rides pilot program is pretty much considered a pot of money as a last resort. So if you do have Medicaid, you really need to try to use that first. But then again, the request could be for something that's not a non-emergency medical transportation ride that wouldn't be covered by Medicaid anyway. So again, it's all of those pieces. And that's why we look to disabled veterans groups and the other resources as well. Salem.
Sorry to jump back about that great initiative you were talking about with the youth transportation. There were some comments in the chat. Terry wanted to say that this is great news. It's a huge issue throughout the state. Teenagers want to get their license and get jobs, but they don't have the money for the instruction or the family doesn't have a vehicle to practice on. And Caitlin was wondering, what about adults going for their license? Could this help them too? But I wasn't sure. And then Terry had to jump off for another meeting. So, sorry to backtrack.
I
So
would
thank
just-
you, Salem.
I think, I don't have children, but my understanding is under a certain age, if a teenager under 18 wants to get a license, they have to have some sort of instruction. And so that's what we're talking about here, is those kids that are under 18. An adult, you don't have to take a class, as I understand it. So that's the distinction between what.
But they may want to take the class if they never, I mean, we've got a situation in Milford where we have a young person, young 20s, 30s kind of thing, who's never driven, never had started the classes to learn, but it was right before COVID and didn't go back to finish them afterwards, is now in a situation where the family's breaking up, doesn't drive, doesn't have access to a vehicle. But certainly that's one of the things that once we get through all these hurdles, will be on the list. So again, I think to go back to what Donna was talking about, it would be real interesting to see what the grant says. So the proposal for the grant will define whether or not it could be used for that.
Sure.
And if I may, under 18, they have to take a course.
Right.
Older youth and even adults that are looking to get their license are required by law to have 40 hours of on-road training with a licensed driver. And that was one of the questions I was going to ask, is if this would help with that as well. And if the big brothers, big sisters taking on the liability for it are the volunteer drivers they're looking for, are they just looking for their time or their vehicle as well?
Well, the vehicle as well, because.
For the liability issue.
I think that's the way we heard it before too, when this first came up. But
Sounds to be determined.
Right, and I'll get more information as it goes along.
Yeah.
So I just wanted to let you know it's back in play. That's great. That's the whole purpose of adding it here.
Anything else, Donna?
Actually, I do have a few more things, but so one caller wanted transportation to the mass medical centers. And I met with Via, and the topic came up as the possible transportation to the Longwood Medical Center. And so we're really happy that the bus, and we mentioned this last night at the meeting, from Lowell to the Pheasant Lane Mall will be happening in July. We don't know the exact spots where it's going to stop, but in some ways that takes care of that leg of it, because people can then get to at least Lowell medical centers, which we knew, Janet, there were a lot of people from Litchfield that went to Lowell, and then they could go on the train and get to MGH a little bit easier. Yeah, so that it kind of takes care of that leg of it, but we still have that Longwood Medical Center. So that could be a good VIA project.
So when you were talking to Via about a Longwood Medical Project, were there any numbers quoted?
No, I never get, you mean in terms of what it's gonna cost? No. No, they never kind of say that. It just doesn't ever come up.
So would this be one-on-one cars or like a scheduled route?
It's like a scheduled route. That's what it would be. So then as far as outreach, so I'm trying to focus as much as possible on senior and disability events in the region. And then I did call the Milford Taxi just to follow up, Janet, and they can't do this at this time. And he said he only has one driver and he can't commit to anything for Milford. So I just want to let you know that.
So I think you were calling Milford.
anyone besides me lost the sound?
Yeah,
Yeah.
I can't, they're frozen on my end.
Okay.
So Victoria, I'm gonna hang up now. So if there's anything that is important or needs a vote on, can you please proxy that? And I'm interested in the next conversation around the alternative meeting schedule. So if you could take notes on that, that'd be great.
Yep, will do.
Thank you.
Yep.
Bye, everybody else.